Hello, dear patients and our followers. I'm Dr. Ahmedov, a hair transplant surgeon from Smile Clinic, Istanbul, Turkey. Today, we are going to evaluate the case of the patient who underwent the hair transplantation surgery in our clinic more than 20 months ago. This is the man with the Norwood type 4V of the hair loss. As we mentioned earlier in the videos we had before, the first thing we do when we evaluate the patient is the level of the hair loss the patient has. For this purpose, we use the Norwood scale. And on Norwood scale, the male pattern baldness goes from level 2 or stage 2 to stage 7. 2 meaning the lowest degree of the hair loss, and 7 means the highest degree of the hair loss. 1 is when the patient has no hair loss, literally. Norwood type 4V means mainly the receding of the front hairline, deep receding on the temples right and the left. There is a thinning of the front forelock, thinning in the hair loss in the front third of the head, and there is an empty spot in the crown area. So basically, it's mainly the front and the crown areas. For this type of patients, on average, you may need the numbers varying between 3,500 or up to 4,500 grafts. Of course, number of the grafts may change from patient to patient, but that's an average numbers. As you can see from the pictures, as mentioned before, the patient has a Norwood type 4V of the hair loss. It's mainly the receding of the front hairline, open areas on both temples, weakened front forelock or front tuft, as we call it, and the thinning of the hair loss in the front third of the frontal area, or transition from the front side to the mid scalp. And there is an empty spot in the crown area that's more than at least 30 centimeters squares in size. And the patient was transplanted 4,000 grafts. Out of this number, 3,300 were used in the front side and around 700 grafts were used in the crown area. And here we can see the result of the patient almost 12 months later after the surgery. The main purpose of the surgery was to redefine the front hairline, fill up the gaps in the front side. Whenever we talk with the patient, we emphasize that the most important area most of the time is on most of the front side. Of course, the crown area is important, but the front side should always be filled up with slightly higher density. Why? Because most of the time when the people see you, they see you from the front hairline till this front mid part. We call this area the front frame of the face. So especially in the progressive types of the hair loss, when the patient needs more than one surgery, we tell the two-step surgery is the best option, and with the first surgery, our priority should always be like the front and the mid scalp. And here we can see the main purpose of the surgery, that the reconstruction of the front hairline, good density in the front line, and the front mid part and the front forelock has been acquired. The patient has a natural-looking hairline. It's acute by the point that we try to keep the hairline conservative, high, and slightly curved at the corners. So even over the years, if the patient loses more hair, we don't end up like with an island of the hair here, empty spots to the back of it. That's number one. Number two, we have the chance to give the patient more coverage and the density. And in the crown area, the patient had an empty spot, and you can see we were able to cover the crown area with the more or less good density. The crown reconstruction is another point or tricky point in the hair restoration surgery, because the surgery, when we do the surgery in this area, it's slightly different compared to the front side, because direction and especially the hole or the spiral the patients have in the crown area needs to be rebuilt precisely so the hair grow in a appropriate direction and give a better illusion of the hair. So as we have mentioned before, the patient had a 4,000 graft transplanted, 3,300 of them the front side and 700 in the crown area. The main purpose of the surgery has been acquired. The patient has a natural looking hairline, good coverage in the front side and the crown areas. So the patient is happy, we are happy. That's a really life-changing surgery for the patient, and hope it helped you a lot. If you have any questions, you can leave the question or your quotes underneath this video and we'll be glad to answer them. Stay tuned and take care.